Dr. Arianne here from the Movement Paradigm. Today I'm going to talk about gluten intolerance and gluten sensitivity. So you've seen it, you've heard it from your friend who can't eat gluten, who's gluten sensitive, gluten intolerant, celiac, but is this a real thing and should everybody not be eating gluten? So let's dive in. So let's talk about first celiac disease. So as it relates to celiac, that is associated with 1% of the population, which is an autoimmune disease when your immune system is attacking itself. It is when someone consumes a gluten-containing food and they have inflammation in their small intestine, so they are not able to absorb or digest it properly, which in essence causes an immune reaction. So outside of that population, about 13% of the population has a non-celiac gluten sensitivity. Although it may seem that there are more than that, that is what's reported at this time. So 50% of those people, of the people that are reporting a non-celiac gluten sensitivity, have experienced either constipation or diarrhea on a regular basis. But in addition to that, there are lots of symptoms that you could experience if you have a gluten sensitivity or intolerance. So let's talk about those. The first thing is going to be bloating. So if you're experiencing bloating on a regular basis, and especially as it relates to when you consume gluten foods, then that would be something that may be suspect that you could have some type of sensitivity or intolerance. Abdominal pain, which again, after you've consumed something that has gluten, is also a very, very big warning signal. Feeling fatigued, feeling just tired all the time, and having joint muscle pain, all of that, it can be factors in exploring gluten. You could also have depression or anxiety. You could also have skin issues, things like psoriasis or even just a dermatitis, some type of skin reaction. You could have things, if it's a little bit more serious, you can have things like neuropathy as well. So there are a lot of different signs and symptoms that could be associated with some type of adverse food reaction that you're having to gluten. It can also be associated with an iron deficiency anemia. So as it relates to the fatigue component, you could also be deficient in iron, and those can be correlated, which also can feed into a thyroid condition, which we'll talk about separately. So when you're experiencing these things, my first piece of advice would be to get evaluated to determine, do I have celiac disease, especially if your symptoms are more severe, or can I explore gluten to see if this is an issue for me? It may or may not be, so it's not black and white. So in order to do that, you can do a form of an elimination diet. Please feel free to reference some of my other videos on adverse food reactions, elimination diet. I've done one on inflammatory foods, just so you understand how you would eliminate the food and then reintroduce it. The reintroduction is the most important aspect of it because that is going to tell you if you have a sensitivity. And also, do your symptoms start to resolve when you've taken this out of your diet? Okay, now here's a fun fact. So have you ever gone to Europe and eaten all the bread and pasta that you wanted and not had any issues? But when you're here, you have all these digestive issues and fatigue and joint muscle pain. So I'm sure if you haven't, you've heard of somebody that has. And I speak to my patients about this all the time because they're nervous. If they go to Europe, they're not gonna be able to eat. And I always say, don't worry about it. Just enjoy yourself, eat the gluten, and things will be fine. And sure enough, they are. Why is that? So there's a few theories behind it, nothing that's very clear evidence-based. But one of the things that is a huge factor is that there are different types of wheat that are used in Europe versus the US. So there's a hard red wheat and then there's a soft wheat. And the hard red wheat is actually it's kind of counterintuitive. It's more of a softer type bread that we are using here. So in Europe, there's actually a lower gluten content naturally in the type of wheat that they're using. So that's one factor. The other factors, the most important one is the glyphosate. So I'm sure that many of you have heard of glyphosate that is used in the pesticides. It's been linked to non-Hodgkin's lymphoma. It's on infomercials everywhere. So the glyphosate specifically has been linked to gluten sensitivity. So glyphosate is used everywhere in the US. We're exposed to it with all of our produce and our wheat products, and it's everywhere. So that it can be a huge factor in why we are so sensitive to it. So the question is it the glyphosate or is it the gluten that we're having such a hard time with, that our bodies are kind of reacting to? In addition to that, there's GMOs. So in Europe, they are highly, highly regulated, and if not illegal in some countries, where here we have them everywhere. We are not meant to eat genetically modified foods, right? And it kind of sounds obvious, but we're not. We have a wonderful, abundant food supply that we shouldn't need to have genetically modified foods. And then last but not least is there's preservatives. So here we have way more preservatives added to our food supply, specifically our wheat products, than we do in Europe. And essentially, gluten is the protein found in wheat, in barley, and in rye. It's in everything. It's in, from sauces to, of course, the obvious things like breads and pastas and crackers and cakes, but it's everywhere. We're surrounded by it. So it is challenging to even explore if gluten's an issue for you, but I strongly suggest that when people come to me with a whole host of conditions and complaints and medical symptoms, that they explore gluten. I don't want to say that it's the end-all be-all, but for many people, it can be very, very beneficial and sometimes life-changing. So it's, to me, a valuable experiment of one to determine, is this an issue for you? And if nothing else, it just makes you think a little bit more about what you're eating and how is this affecting your health, because there is always a reason that something is happening, and it's just about figuring out what that is. So I hope this helps, and if you've liked this video, please hit like. If you liked it a lot, please feel free to share it with a friend or family member that might benefit from it, and please subscribe to my YouTube channel, hit that little alert button so that you can hear any new topics that I'm bringing on. And of course, I would love to hear from you about any topics that you want to learn about. So thank you, until next time, bye.